Hi everyone, I'm taking a class on Corona Help I Wash You, and I want to talk about the stigma surrounding COVID-19 and what we can do to stop the spread of it. First off, what is stigma? Stigma can be defined in several different ways. For instance, it can be understood as a mark of shame and discredit, or a disgrace associated with a particular circumstance, quality, or person. During a global pandemic, it is imperative to specifically recognize health-related stigma, which is the negative association between a person, group, or nation and a specific disease. This stigma is fostered by a lack of knowledge and our ability to alienate those different than us. This stigma can also be propagated by people in power. Because of leaders' massive platforms, their messages matter the most. With that being said, leaders must carefully message accurate information in an attempt to prevent certain groups from facing stigma. An example of a leader abusing his platform and provoking stigma is President Trump. By referring to COVID-19 as the Chinese virus, Trump has prolonged stigma towards Chinese individuals. Trump's approach towards the pandemic has increased xenophobia and racism in the United States. And in a time where we all must be kind and come together to address COVID-19, Trump's actions have divided us. So what can we do? How can we address stigma? Well, prevention methods really do matter, and we must spread them. However, we must approach broadcasting these messages with caution and only disseminate accurate and uniting messages. It is very easy to give someone the idea that COVID-19 is a disease of the poor or a disease of foreigners, and these messages are so far from the truth. Currently, there are several destigmatizing campaigns across the U.S. However, not every state has advertised these important messages. So, as caring citizens, we should start grassroots campaigns in our areas by creating basic-looking infographics for everyone to understand that address accurate information about the virus and the stigma surrounding it. Another way to address stigma is by normalizing testing. We should speak about testing and listen to our peers as they give feedback about their experiences. And if an individual is hesitant about getting tested, we must reassure them that it isn't weird or wrong. We must also transform testing into a positive experience. One means of accomplishing this goal is by providing at-home testing. This method is not only comfortable and private, but to some individuals, it may also be less stressful than going to a testing center. Ultimately, we must reframe COVID from something seen as guilty to something that everyone is vulnerable to. We must stop using terms like COVID victim and COVID patient. We must continually educate ourselves and the public. We must protect the most vulnerable. And most importantly, we must be kind to each other.